Hey everyone, I just wanted to follow up on the Acuity tool worksheet that we've been using about the last week. Thank you very much for taking the time to fill that out. It's been very helpful, and we're trying to continually track the data that we collect. So with that being said, just a few reminders that are going to be very helpful for this tool to work is to ensure that all the information is filled out. So date, room number in order to identify the patient, whether you're on day or night shift, the type of surgery, and what their hospital course day is, post-op day 0, 1, 2, 3, or 4. So it's just really important for us to continue to track acuity numbers so the workload of the patient is being accurately captured. There's also really some great feedback from staff in regards to what's on the sheet or what's omitted that needs to be on there. So thank you for bringing that to our attention as well. And we've made some changes based on those responses. So some of the concerns, for instance, was about ambulating a patient. They may or might, somebody may have a couple of drains or chest tubes that is able to just, you put them in the cart and they're able to wheel around the unit just fine. But sometimes another person, as we all know, may be a lot more difficult to get out of bed. It takes a lot of time to transfer, to move, to get up, to walk, to have multiple people in there to help you. So we've listed those in the same box to help better address that. There's also a situation that was brought up that maybe the patient's doing well, but they're just unable to, let's say, feed themselves, and it takes a lot of time, as we all know, to do those tasks, and it's a big time sucker out of your workday per se. So, for instance, let's say you have a patient who, 65 years old, status post to FemPop, has a history of MS, and that patient has difficulty feeding themselves, also has like a really unsteady gait when they get out of bed, and it requires more than one person, so 2 people or more to ambulate. So in that situation, just in purpose of filling that out, we would put their information at the top, and then I'd go through the list of what that patient requires. So in his instance, we would start with he has a very unsteady gait, so he'd require 2 or more people, or it could take longer than 10 minutes. So you want to make sure you circle everyone as well, so we capture that data instead of just totaling it at the bottom. So we need to know which points are on the sheet. This patient would also be ICU status. I forgot to mention that he also required a vasoactive agent overnight for low blood pressure, so he's on phenylephrine. So he'd be ICU status for that, and then he would also be on a phenylephrine infusion. And then in addition to not being able to feed himself, it's fine to quantify that as total care at that point, so you can circle this. And so these would be the points that we would circle, and this patient would have a score of 3 plus 8 and 5, so that would be 3 plus 8, 11 plus 5, that'd be a total of 16. And that's basically how that would work. So don't want to try to make it too complicated, so just use best judgment that you have for that particular day, because it's always going to change. I mean, maybe this guy's they renew his medication and his symptoms progress, and he's able to feed himself the next day. So we realize that patients will either move forwards or backwards. It's just a tool to make sure everything's being accurately captured and that the workload is balanced. So, and that's the purpose of it. So thank you very much for filling this out, and we'll continue to hopefully make it better and make it a useful tool. So thank you very much.